I'd probably had it 4 or 5 years. It only really kicked in where it was affected me quite severely. It was when I started a new job where I stood on my feet a lot. When I'm stood on my feet for 8, 9, 10 hours. And that's when I really thought, I've got a problem here. I didn't do anything for too long, really, because I didn't know what to do. I tried, because I'm in the fitness industry and I know a little bit about anatomy and physiology. I tried to help myself, doing a lot of core work, a lot of glute strengthening, as much as I could. Nothing really helped it. So that's when I decided I needed to see someone medically trained and a professional. I had private health cover, so I went to see a physio and he recommended Mr. Kapoor. I think he'd worked with a lot of patients who'd been to see him and had good results. So I rang the Alex and asked if I could make an appointment to see him for a consultation. He kept things very, very straightforward, very black and white. First consultation, went in, I told him my symptoms. He says, right, let's scan you. Had a scan, got my follow-up appointment for a week later, went back, he showed me the scan and he said, right, you've got a condition called spondylolisthesis. And he says, and if at your age, in the condition you're in, I recommend we operate. And I had no hesitation, really. Mr. Kapoor stressed that it was a major procedure, it was major surgery. When that's happening on your spine, you get the woolies and you have to speak to your family and your friends, just think, if this goes the wrong way, I could be in trouble here, but I'm trusting someone who does this every day. That's what they've trained to do. So no, I was a little bit nervous at first, but Mr. Kapoor was great, he settled my nerves. Without it, I wouldn't have been able to carry on doing the things which I love doing, which is my five-a-side and my golf and my running and my trainings. Yep, I had the operation December the 17th, 2016. Within 3.5 months I was playing golf. And we're now in August, so we're 9 months down the line. I just started doing some proper running. Me contact sports, like my football, Mr. Kapoor said I need 12 months, which obviously I'm going to listen to, and then may go back to that again, I may not. But in terms of gym work, I was back in the gym 2 months, so it couldn't have gone any better. I went in, I think I had to be there about 11 o'clock on the day. They took me up to the room, got me changed into a full regalia. Mr. Kapoor came in, they'd done my pre-op stuff had already been done, but I did a few more tests, so I was fine. And he just really put me at ease. He said, I'm sat on the bed, he said, you look worried. I said, yeah, I am. He says, well, don't be. He said, this is what I've trained for. So I says, right. And there was a rumour that the operation could make me a little bit taller, which we went after. It's because everything helps. So no, like I say, we had a crack and a joke, and that was it. I was off down to theatre. So he got me back to my room, woke me up. Nursing staff were brilliant. Mr. Kapoor came in regularly. They had me up on my feet very quickly the same day, which was great. Really encouraged you to move as much as you could, which gives you a little goal. I want to do X amount of lengths of the corridor today, and tomorrow I'll do a few more, then a few more. Then they have to say rein it back in because you're doing too much, but so it's catch-22. But no, I couldn't fault them at all. It was fantastic. I saw him 3 or 4 times quite regularly, really, which was great. So I told him what I was doing, and he said yes or no, don't progress it, or just, yeah, you can crack on with that, or just rein that in a little bit, working with the physio. And it was 6 months, almost to the day, that I got x-rayed every time I went back as well, which I found really comforting. So you're looking at it on the screen, and he said, look, that couldn't have gone any better. It's great, you see all the metalwork in your body, and you see where the bone graft was done, and you see this bone graft getting thicker and stronger, which gives you peace of mind. No, and I got discharged 6 months to the day, and I'm pain-free. And I'm back on my feet. Again, in my job, I'm on my feet 10, 11 hours a day. Nothing, no pain whatsoever.